Welcome back to the show, Mark and Stephanie. Mark, it's especially good to see you up and about.
Yes, I'm glad to be up and about. It was kind of a bad situation back in March when I first contracted COVID, but thankfully I'm much better now.
Absolutely. And I see that big smile on Stephanie's face, and she's grinning from ear to ear. And I know you were a big part of his recovery. You know, let's take folks back. You guys have been on the show a couple of times and really appreciate you sharing your journey. So take us back. How did you first contract COVID, Mark?
It started back in early March. National Brotherhood of Skiers had a trip that we attended in Sun Valley, Idaho. It was about 600 of us in total. And we out there skiing and partying and having a great time. And once I got back home to Pompano Beach, Florida, I became sick and found out that about 100 of the 600 people that had attended this ski trip were also sick.
Yeah, it was very much in the news about what happened. I think 4 of those members or so passed away, unfortunately.
Yeah.
You know, when you first became sick, were we even talking about COVID? Was that even in the conversation?
Actually, it was, because we had heard that people in Seattle had gotten it, but it wasn't really a lot of information in the news as far as I knew, and at the time I really wasn't concerned about it.
And this one sitting next to you, this wonderful woman, she said, "Oh no, you gonna help my husband." So
Absolutely.
It was through your insistence, Stephanie. Let's talk about what you said needed to be done and what happened.
So because Mark got so sick so quickly and his decline was so extreme, it was literally, we got off of the airplane, we were both dragging the next day, we both thought we just had a benign tickle in our throat, and he just started to look really tired. And I thought, well, we've been partying and skiing for 2 weeks, it's probably just jet lag and too much fun. The next day, however, that Monday, he was clearly sick. This was March the 9th. He was clearly sick, coughing, looked horrible, just had this very drained appearance. So I had a feeling, I said, you know what? I'm not a doctor. I should definitely investigate this. I had a feeling it might be something. So I just thought I would call the hospital here locally in Fort Lauderdale. And I got no help. They didn't have any understanding of what the testing procedure was. There was no protocol. And I kept asking questions. Well, how do I find out how to get them tested? Well, we don't have any tests. So I just, every day I would start calling and calling. And by that Thursday, March 12th, I called the primary care office and said, my husband is very sick. He's been very sick. I need to get him tested. And they basically said, we have no COVID test, call the health department. So I called back to the health department, and the health department said, don't say COVID, say you want to rule out the flu, because that way they'll at least get him in. So that's what we did. They ruled out the flu. They sent us to urgent care to get him tested. And we actually had to go roundabout to get him there, but we did end up in the hospital getting him tested. And he found out 4 days later that he was in fact positive. But it was,
you know what's surprising is that they didn't keep him in the hospital. You brought him home to care for him.
Yes.
Well, I think the criteria at that time for the hospitalization was that your fever didn't resolve and that your pulse ox, which is the amount of air you're actually getting into your body and using to breathe, it has to be between 95 and 100, and his was around 97. And so they let him go. But I actually have to say I'm happy. As hard as it was to care for him at home, at the hospital, I wouldn't have been able to bring him any smoothies or vitamins or all the good things to help his immune system. And I wouldn't have been there to cheer him on. And it's a very devastating, unfortunately, situation now with the hospitalization.
Okay, Stephanie, you're going to have to give us those recipes for those smoothies, because those smoothies were obviously miraculous. I don't know what you were putting in them, but they did the trick. So let's fast forward a little bit. How many days was Mark? And Mark, I think you were in and out of it, so Stephanie's probably going to have to answer this since she was doing all the caregiving. How long was he actually out of it, on his back, couldn't move, so sick?
The worst of it was about 10 days. Meaning sleeping 20 hours, not eating, not drinking. I mean, I had to wake him up and make him drink hot lemon water, which is the #1 thing because this virus doesn't like heat. Doesn't mean that people in Florida are spared. I don't mean that kind of heat. I mean in the body.
Right.
Unfortunately, that was a myth. That's not true. But the hot lemon water, lemon was basically helping his immune system, and I tried to push that, and then he would just fall back to sleep. So about 10 days, we were just fighting to get food in him and keep him hydrated and take his medication. He was treated for bacterial pneumonia, so was given 2 antibiotics. And when he was given those 2 antibiotics, we basically were able to mark his progress from day 1 to day 10. So when he finished the second round of antibiotic, or second antibiotic, it was just 1 round, I started to see him eat a little more and perk up. And by about the 3rd week, he was walking around a little bit and listening to music and starting to look like himself.
That is so wonderful to hear. So when we come back, I know folks want to know about what's happening now. What's the update? So we'll get the update from Stephanie and Mark when we come back. Stay with us.